All, this is Dr. Mobeen Sayed from drbeen.com. Welcome to one more show. In the description of this video, there are some links that would help you get Dr. Bean's access at a very low price. So with that quick plug, here is a discussion that I did a few days ago. This is a study from CDC. The study is outcomes at least 90 days since onset of myocarditis after mRNA COVID-19 vaccination in adolescents and young adults in the USA. A follow-up surveillance study. So if you see here, for example, Matthew is CDC COVID-19 response team, USC. So these are all, if you see, COVID-19 response team, Margaret from COVID-19 response team, Malika COVID-19 response team, Karen COVID-19 response team. So it's a CDC study. It's an observation or surveillance study. I did a discussion of this. However, there was a data point or a presentation of data that I would have presented differently. So I wanted to show it to you just so that when you're reading this study, you are aware of this interesting way of presenting data. So I'm not going to go over the whole study. I want to go over the results in this part. See if you can spot it, and then I'll say it as well. They said for 393, 47% of 836 patients, healthcare providers were contacted. So this study was actually, they asked the healthcare providers to say, hey, you had this patient who had myocarditis. How is the patient doing? And then what are the labs that you did and so on. So healthcare providers were contacted. 241, 61% of 393 were cardiologists. At the time of the survey, healthcare providers considered 320 or 81% of 393 patients to be recovered. So far, so good, right? So they asked the doctors or NPs or PAs or whoever and said, hey, how's your patient? And the doctor said, doing okay. So 81% of the cases 90 days after the myocarditis, the doctor said doing okay. But check this out. 261 patients were considered fully recovered. And 59 or 15% patients were considered to be probably recovered, but awaiting further information. That is, if let's say your child has myocarditis, 13 years of age, 90 days later, the child goes to the doctor. The doctor says, I think you're doing okay, but let me run the labs and let me get those data. You look okay. Or your signs and symptoms look okay. Your general physical look okay. Your heart sounds look okay. Or sound okay. So I think we should just get your labs as well. That is 15%. This 81% includes this 15% as well. And they say it, I mean, it's not that they're hiding it. They say it over here, patients fully or probably fully recovered. If I was in their team or if I was a peer reviewer, I would have told them to leave this cohort out or wait for this cohort's data to be received to add that to this 81% or this number to make 81%. I would have actually said, just leave it out and work with your 66%. I do not know how the study actually passed internally and then passed the peer review as well. I haven't heard of such terms as probably recovered, but that's a term they use. Similarly, on the not recovered side, There is also an interesting group that I did not mention that day, and I wanted to. So here we are. An additional 61 patients had improved. That means they didn't recover. And 4 patients had the same cardiac status as at the initial myocarditis diagnosis. 4 patients did not improve at all. So they put these two together as well. And they said, you know what, 61 plus 4, 65, not improved or not recovered. If I was putting this together, I would have eliminated from the data point this 59 that were probably recovered. How would I have a study with probably recovered data? I would have removed it or waited for this data to come in. And then on the non recovered side, I would have created 2 columns, recovering, and another column did not recover. And I would have said that, you know what, 4 patients out of 320, more than 1%, did not recover at all after 90 days. So they presented it as patients fully or probably fully recovered. So that becomes the 2. And patients not recovered, that becomes the other 2. I would have, once again, last time I'm saying it, patients fully recovered here, 260 or whatever, patients recovering or not recovered here, patients with no change in their disease status, separate. That would have given a much better view. Maybe the 4 that did not recover at all, maybe they were between 15 to 19. So we'll become a little more careful. Maybe they had comorbidities. We'll figure out which comorbidities. Similarly, the patients who were recovering here, the probably recovered, maybe when their data comes back, they actually, let's say half of them are not recovered. So how can we play so loose with the data? Being the CDC, being the one to set example for the rest, to say, this is how you do studies, this is how you present data. What was the need? I think the need was that, hey, we want to give at least a larger cohort so that the stats look, more, they have more power. But I would have left this out. So anyways, if you read this study, if you watch my previous video as well, so please add this little additional information. There are actually 4 groups in these 393 patients. Not 320 recovered or fully recovered, and the remaining 19% not recovered. It's actually 66% fully recovered, 15% probably recovered. I would have actually just not even had that group here. 16% recovering, still recovering, and 1.1% not recovered at all. And then I would have said, we will come back in 2 months or 3 months, and we will give an update and do a follow-up. That's how I would have done. But anyways, be aware that this is how the data is, and I would have done it differently. So with this, thank you very much. This is the last time, I promise, over a weekend to bother you. Please like, subscribe, and share. There are some links in the description. If you like this work, if you like what I'm presenting, if you like the mechanisms, support this work. There are links. You can buy Dr. Bean's plan for, I calculated it's 10 cents per video. How can you get 10 cents per video for a medical video? Anyways, there are 900 or more videos on Dr. Bean, and the price is under $100 one time. It's not a monthly price. Plus, there are links in the description. You can use them to support this work. You can use PayPal, or you can buy me a coffee, or you can become part of patrons and Substack and so on. So you can even become part of YouTube as well. So with this, Thank you very much. Have a nice weekend, and I would see you on Monday.